procedure. Step 1. Perform hand hygiene. Select a tray to use as your aseptic field. Ensure it is large enough for your preparation and procedure, is robust, has sides, is easy to clean and is portable. Clean your tray with a surface disinfecting wipe and allow to dry. Note that the tray is not clean until it is completely dry. Step 2. While the tray is drying, gather all equipment required for the procedure. For preparing an intravenous medication, this includes drug vials, syringes, needles, flushes, luer locks, cleaning wipes, and medication-added stickers. It is important to gather all equipment so that they are close at hand around your chosen aseptic tray. Take time to think about tasks you need to do prior to commencing your medication preparation, such as completing drug calculations and preparing your medication-added stickers. Step 3. Perform hand hygiene. Step 4. Put on a pair of gloves. Gloves are primarily to protect you from exposure to drugs and body fluids. Take time to think about which kind of gloves you need. For aseptic non-touch technique procedures, use non-sterile gloves. Step 5. Assemble and prepare your equipment using a non-touch method, taking care not to touch any key parts. Place equipment in the reusable tray, taking care to ensure this tray remains clean and tidy. The most fundamental aspect of aseptic non-touch technique is being able to identify and then protect key parts. When it comes to intravenous medications, key parts are those which come into direct or indirect contact with the medication or liquid infusion. If you contaminate your gloves at any time, remove them, perform hand hygiene, and put on a new pair. Contamination could include using a calculator or pen, or touching the medication chart or computer. Step 6. Once your medication is prepared, double-check to ensure you have all the supplies you need in your tray. Dispose of waste appropriately. Remove gloves and perform hand hygiene. You are now ready to administer your medication at the bedside. It's important to try and administer the medication immediately after preparing it to minimize any environmental contamination. Using your 5 moments of hand hygiene, enter the patient's bed space. Step 1. At the bedside is to prepare the patient. Take time to consider where you will put your tray and your rubbish. This includes ensuring you have clear access to your intravenous access port and pausing the pump if there is one running. Step 2. Perform hand hygiene and put on gloves. Again, take time to think about what kind of gloves you need. Remember, if you can perform the procedure without directly touching key parts or key sites, use non-sterile gloves. If it cannot be performed without directly touching key parts or key sites, you need to consider a sterile approach. Note that although key parts are not touched when performing blood cultures, sterile gloves are required. Step 3. Thoroughly clean the key part or site you are going to use. In this case, it's the peripheral line needleless connector. Key parts need to be cleaned with 2% chlorhexidine and 70% alcohol for 15 seconds. Ensure your wipe is large enough to cover the top and sides of the site you are cleaning. Ensure you clean vigorously, cleaning the top first and then the sides. Let the key part dry completely. Remember, it's not clean until it's dry. Step 4. Complete the procedure. If your gloves become contaminated at any point, remove them, perform hand hygiene, and put on a new pair. If your key site becomes contaminated, clean again for 15 seconds and allow to dry. Remember that used equipment and rubbish cannot be placed into the clean aseptic tray while performing the procedure. Step 5. Once you have completed the procedure, dispose of all waste appropriately. Remove your gloves and perform hand hygiene. If you used a reusable aseptic field such as a blue tray, clean it thoroughly with a surface disinfecting wipe. If there is any bodily fluid contamination, clean with soap and water first, then the surface disinfecting wipe. Perform hand hygiene.